Mute all. I think we were muted, so we'll start over again, and hopefully this works. Someone can send us a chat and just let us know if you can hear us. Hello, and thank you for joining today's presentation entitled Engaged System of Care webinar for our first cohort of communities. I'm sure most of you know that today is National Children's Mental Health Awareness Day, so it seems very appropriate for us to be holding the System of Care webinar today as a great way to honor this important day. I am Angela Sosser-Short, the Engaged Project Director, also the Chief of the Bureau of Children and Families at Mental Health Addiction Services and the Ohio Family and Children First Director. Joining me on this webinar will be Patrick Canary, Director at the Center for Innovative Practices, Case Western Reserve University. Neil Brown, Wraparound Consultant. Scott Wingenfeld, Evaluator, Ohio Mental Health and Addiction Services. Chris Dorman, Senior Research Associate, Begun Center for Violence Prevention, Research and Education at Case Western Reserve University, and Rick Shepler, Senior Research Associate, Center for Innovative Practices at the Case Western Reserve University. Before we begin this webinar, we do want to go over some webinar housekeeping. We will be recording this webinar. After the webinar, we will send today's PowerPoint presentation and a link to the audio file to the entire Engaged First cohort of communities. Please share with those that may not have been able to participate today. Now let's discuss how you can participate in today's web event. For those logged into the actual webinar and not just the audio portion, you should be able to see the Engaged main title slide on the left of your screen. A control panel should be on the right. It is within that control panel how you participate in today's event. So let's look at that for a moment. You'll see the little orange arrow there. That's how you will open and close your control panel. And from there, you're able to either auto-hide the control panel or leave it open. That's your choice. The auto pane shows if you're connected by mic or speaker. And then most important one I want to point out is the question box. If you enlarge the question box, you can ask questions throughout this entire webinar. And in between our different sections, we will pause for a moment to respond to some of the questions. At the very end of the webinar, we will take questions via phone or audio, and you can raise your hand by clicking on the icon of the hand, and we will unmute your line so that you can ask your question. And just a reminder that today's webinar is being recorded. So here's our agenda for today's webinar. We will be providing an overview of Engaged to ensure we are all on the same page regarding its goals, target population, and timeline for implementation. We will spend some time reviewing the expectations of the first cohort of communities, which will include an on-site readiness assessment, which we will go over in detail with you today. We will be discussing the wraparound training and technical assistance components and how such assistance will be provided to your communities. We want to share with you the Engaged evaluation process and what will be required by the communities for this evaluation. Many of you are aware of the transition to independence process model. We are working to align TIP with wraparound for Engaged, so we want to make sure today that all have a basic understanding of TIP and how it will connect with wraparound. And as I just went over, we have dedicated time at the end of the presentation for questions and answers. However, feel free to use the question box to submit your questions throughout the presentation. If we have time between the agenda items to address a few, we will definitely do so. We also plan to send a question and answer document after this webinar in case we run out of time and don't address all the questions today. So we wanted to start out with what is Engage. I imagine all that are on this webinar today have a good understanding of what Engage is, but to just recap, this is Mental Health Addiction Services 4-year SAMHSA grant with the purpose of expanding the system of care approach statewide focused on youth and young adults. The definition for a system of care is a spectrum of effective community-based services and supports for children and youth with mental health challenges and their families that is coordinated, built on meaningful partnerships with families and youth, and addresses cultural and linguistic needs to help them function better at home, in school, at work, in the community, and throughout life. So who are we targeting with Engage? Our target population for Engage are youth and young adults in transition between the ages of 14 to 21 with serious emotional disturbances and may have co-occurring disorders, that being substance abuse or developmental disabilities, and must be at risk for currently or previously involved in child welfare, juvenile justice, and or homelessness. Again, we are really targeting the youth and young adults that have a mental health diagnosis, but not necessarily co-occurring disorders, but must be at risk, involved, or have been involved in child welfare, juvenile justice, or homelessness. Our purpose is to improve outcomes related to health, educational, employment, and living stability for high-risk youth and young adults through statewide expansion of the evidence-supported, research-based, high-fidelity wraparound practice. We have 4 goals for Engage. The creation of the first cohort of communities will be addressing Goal 1, and implementing high-fidelity wraparound addresses Goal 3. Also in Goal 1 is the State Governance for Engage, which is the Office of Health Transformation, Health and Human Service Cabinet, who will ultimately respond to policy and fiscal recommendations that impact this population, and they overseeing the grant requirements is an Engage management team. For Goal 2, we are focused on increasing youth and family voice at the state and local level. We have contracted with NAMI Ohio, who has contracted with individuals that serve as our youth and young adult engagement coordinators, our youth and young adult supporter, and our family engagement coordinator. They have recently launched our Youth and Young Adult Advisory Council and the Family Advisory Council. The members of these councils are anxious to begin working with you all as our first cohort of communities for Engage in terms of how to ensure youth inclusion, youth voice, and family voice in wraparound. In addition, they are addressing Goal 4 by reaching out to families and youth through social media to support Engage. For Goal 3, I do want to point out that, again, this goal is focused on supporting communities with implementing wraparound. And we are also working with a state-level policy and fiscal team that is currently developing a finance plan. And the finance plan is focused on how Ohio will expand the array of services and supports for youth and young adults. This finance plan is due on July 31st of this year. We have contracted with Voorhees Healthcare Advisors, who are currently assisting our team in developing the finance plan. So who all is included in the first cohort of communities? We have 28 counties who have been highlighted in color that will be receiving training and technical assistance on the high-fidelity wraparound in this first cohort. This map indicates the many regions that we have created to deliver the training and technical assistance, ensuring that no one has more than 1 hour of a drive to training or technical assistance. I should point out that there are 4 counties highlighted on this map: Hamilton, Claremont, Stark, and Cuyahoga counties. These 4 counties have received the SAMHSA System of Care grant in the past, so they will be integral to our learning communities and coaching development. I want to spend some time going over the timeline for Engage, particularly for this upcoming year through June of 2015. So currently through June 30th, we are working to conduct on-site assessments, which we'll go over more in detail in a little bit. We're currently finalizing the training and technical assistance package. From July to September of 2014 is really when we launch Engage out to all of you. And that is when the training and technical assistance will begin for the first cohort. As I stated, we're going to be conducting on-site assessments, and based on readiness, some counties, depending on where they are currently with implementing high-fidelity wraparound, we'll begin to enroll youth into Engage Wraparound and be able to receive funding. We also will begin collecting data on the youth that are enrolled in Wraparound for Engage. And we are hoping that the Youth and Young Adult Advisory Councils and Family Advisory Councils will be supportive and will be available to assist you all in on best methods for engaging youth in Wraparound. And we will begin working with Ready Communities on capacity building for collaboration across systems to really support Wraparound. And then from October to December, we will continue providing training and technical assistance with a specific emphasis on fidelity measurement for Wraparound and monitoring. We will begin training experienced Wraparound facilitators in becoming regional coaches for newer communities. We will formalize the regional learning communities, and we will also provide cultural and trauma-informed training, cultural competence and trauma-informed care training to the first cohort. Then in January through March, we will launch the Engage data system, and we will continue targeted training to the first cohort. And our goal right now is between April and June of next year, we will move forward and select our second cohort of systemic care communities and begin training and technical assistance to them. The last piece I want to go over is the cooperative agreement. I will be sending out this cooperative agreement in the next week or so, and this will serve as an understanding between the Department of Mental Health and Addiction Services and the lead communities for Engage Wraparound implementation. This agreement will help to formalize this partnership, but also allow us to know who to direct communication to about trainings and updates, etc., who will serve as the fiscal lead or fiscal agent for Engage, and specify roles and expectations for Engage Wraparound, including data collection, fidelity measuring, participating in training technical assistance, and the reimbursement method for Wraparound. Okay. So now I'm going to turn it over to Patrick Canary, who will be providing information about the Engage Readiness Assessment.
Great. Thanks, Angela. Welcome, everybody. The site assessments actually are going to be the first kind of on-the-ground piece of the rollout of engagement of Engage. So we're really excited about that. Cliff Davis is on this webinar as well, and so if there are questions specific to this, Cliff will be able to respond by the chat function or can communicate with me. But I want to go over just briefly kind of the idea of the site assessments and why they're part of this process. So this is, builds on the survey information that you all sent in several months ago. But what we wanted to do was really to get a face-to-face sit down in real time, in real life, about how things are actually going, how your counties are actually implementing Wraparound, what are the systems needs, kind of what barriers are you facing, or what facilitators have really been helpful. Because again, as Angela said, we'll also be creating learning communities, and part of this is gathering also what's helping support the intervention in the program. We also want to be able to identify more precisely what your long-term needs as sites would be in regarding any kind of technical assistance that might be needed over the long haul. We know that implementation of Wraparound or any other effective service goes well beyond the initial training. That's why the coaching piece is built into this. But we also know that there will be ongoing needs at the systems level for technical assistance. So we want to be able to start, making that list and getting ready for what your needs might be at that level. So next slide. So we have a template, and I think for those of you that Cliff has already communicated with, he has sent you an outline of the kinds of questions that he'll be walking the key stakeholders through. But essentially it's looking at, how does it work on the ground in your community? How is it supported financially and administratively? What kinds of level of support do you have across systems for the implementation of wraparound? What's the level of engagement and involvement regarding the family and youth voices? I'm sorry, I was just asked to speak up. My apologies. What kind of current data gathering are you using, if any, at this point in your programs? And what is the availability of transition-oriented programs and services? So as you know, one of the things that's very unique about this implementation of wraparound is the focus on young adults. And so we're kind of crossing over that territory from the youth and family system into the young adult system. And so we want to make sure that all of the transition-oriented programs and resources are identified and available. Okay, next slide. So Cliff is in the process right now of scheduling site visits. I think about a little over half a dozen have already been scheduled. We want to do this in a way that best meets your needs and can address the process efficiently. So face-to-face on the ground is one option. The other option is to schedule a conference call, but we would want to make sure that all of the appropriate community representatives are there to participate, and just want to make this work in a way that is best for everybody. So they're underway. Cliff has the contact information that you all supplied as to who the point people are. So that's the person who would be getting the initial reach out from Cliff to schedule the site assessment. And I think that's it.
Okay, Patrick, there's a question. Our county is currently using high-fidelity wraparound. Our county is not currently using high-fidelity wraparound. Is that problematic?
No. I mean, that's exactly the kind of information that we'll want to hear. We know that we have among this cohort, which I think is 28 counties, a wide range of what's being implemented under the umbrella of wraparound. So we know that some counties have been trained in the high fidelity model, particularly those that have been involved in the system of care sites, the federal sites. But we also know that many counties either received training perhaps a while ago, perhaps received training independent of any state level involvement. So no, this is really the point, is to find out where folks are and be able to really tailor the training to start at a place that really meets your needs.
Okay, thank you. And we have another question. How much time should be allowed for a face-to-face site visit?
Really good question. And I'm going to say, and Cliff will maybe type a more specific answer in here, but I think we're looking at least a couple of hours. We don't want to, there we go, 2 hours. We don't want to overburden, but we don't want to make it so brief that we walk away with 5 more questions we need to circle back. So I think if you could think about a couple of hours as the window, that would be great.
Okay, thank you. And then there's another question. Will we be told if members of the youth and parent councils come from our county so we can connect with them? And I can answer that one. Yes, we will definitely notify you if any of the members that are currently serving on the Youth and Young Adult Advisory Council and or the Family Advisory Council come from your county. The Youth and Young Adult Advisory Council is also extremely active in trying to engage additional youth who aren't actual members on the council, but they are being connected and included in engaged activities and part of the social media. So we'll let you know if there are youth in your area that you may want to reach out to and involve in engage wraparound. Okay, we are now going to move on to the Ohio Engage training component, and Neil Brown will be reviewing the Ohio Engage training component.
Good afternoon, everyone. Glad to be here. Feel free to type in if you can't hear me. I'm glad to talk about training, and actually before I talk about the content in the slides, I want to talk about something that I don't think we addressed in the slides, and that's the question, or a statement perhaps some of you have had in your mind, which is why training again? Both Angela and Patrick have acknowledged, and I certainly would too, that there have been lots of training around wraparound here in Ohio and across the country, and I want to try to talk for a minute about why this training, so to speak, is important. And for me, there are really two critical factors in thinking about participating in training again, both on all the levels that we'll talk about in a few moments. One of them is that the wraparound field has continued to evolve. My first involvement was 20 years ago, and it certainly has grown and changed since then, but it's changed in a couple of critical ways, I think. One, at the community level, in terms of the system of care development, there's been lots and lots of experience that's taught here in Ohio and elsewhere that's taught us a lot about, quote, the necessary conditions, and some of the work that's gone on nationally around trying to clarify what's the right nest, so to speak, what's the right home for wraparound in community systems. I think that content has emerged very differently than it was as short as 3 and 4 years ago, so I think that's an important piece. The other important piece around training is that the art of facilitation around this work, I hope, will continue to evolve, and certainly has. You know, just thinking about the nitty-gritty of what we do around teams and how we craft invitations that get better follow-through than not, how we do planning in a team that creates the kind of diverse, multifaceted plan that we're after in wraparound. Those things have continued to grow and change over the last few years. And so what we really hope to do with these training components is kind of bring the latest from the field to all the Ohio counties that are involved. And I know that many of the counties in this cohort have been trained anywhere from a few months to many years ago in an effort to build a consistent approach and a consistent response to youth and young adults in transition. I think it's important for us to come together again and talk about those concepts. Having said that, the slide you see in front of you really speaks to what we're after. One, we want effective facilitation of a wraparound process in multiple communities across the state. In my experience, wraparound development has never meant lockstep from community to community. But as we build a state system of care responding to this target population, it's probably important for us to revisit, can we be clearer and better around effective facilitation? I think the answer is yes. Therefore, that's one of the key aims of training. Second, one of the lessons I think I've learned about wraparound in the last few years is that as much as the field has nationally defined itself more and more over the last few years, there continues to be a reality that wraparound tends to look like where it fits as opposed to what it's defined as. And what I mean by that is, I'm going to use an example from far away so as not to step on anybody's toes in Ohio. But I think often about Vancouver, Washington, which is a community that's seated or seated wraparound in schools, mental health, child welfare, developmental disabilities, and the court. And as that project emerged, one of the things that got very clear was that wraparound easily takes on the flavor of where it's housed. And that's what I mean by wraparound looks like where it sits as opposed to what it is. And so the orientation piece around kind of casting a broad net about what is wraparound, where has it been, what have we learned about it, and how do we create the right nest for it is the goal behind this effective orientation. Both Patrick and Angela mentioned that we're creating the capacity to do some coaching, to build some additional expertise to provide support over time in counties. And that really speaks to the experience that I think we've had not only about wraparound, but a number of more recent models around intervention and planning on the community level, and that is the training gives us a sense of what to do, but doesn't always help us get it done. And coaching, I think, is designed to help support that in a variety of ways. So those are really the key aims of training. If we hop to the next slide, you'll see that what we've planned at this point is to have an overview a broad group of community participants and stakeholders who could participate in training to hear about what is wraparound and what to expect if you're a part of it. For facilitators, we're looking to bring together the latest integrated wraparound facilitation training content, looking at all 4 phases of the process, trying to bring, I hesitate to use the word to state-of-the-art because the state-of-the-art usually lasts about 10 seconds in my experience, but to bring the best we can to that. And finally, the third target audience is coaches, presumably a smallish cohort of folks who would get some additional support around how to effectively support wraparound implementation in communities. The next couple slides, if we jump to the first one, gives a little more detail about each of these training focuses or content areas. The community overview training, obviously I think we still need to do a broad overview in history. Where has it come from and where has it ended up? There's some lessons around implementation here and elsewhere in Ohio that are probably important to pass on. One of them being wraparound tends to look like where it fits as opposed to what it is. There are 6 themes that have been identified on the national level that include the notion that, and many of you have seen these in some of the products out of NWI, but the notions of community partnership, collaborative action, fiscal sustainability, staffing capacity, creating the right capacity in terms of accessing needed services and supports, and finally accountability. Probably need to talk about all of those themes in each community, and I will step back here and say that in my observation of counties here, states elsewhere, counties and organizations elsewhere, the challenge around these 6 themes is that we all get them. We all look at them, I think, and go, yeah, that makes some sense. But they tend to be more complicated than simple to get on the ground in concrete ways, and each community has different strengths around those 6 themes. So part of that overview training is looking at those. Part of the readiness assessment is helping people think through which of these are strong suits and which of these should we pay attention to. And finally, in the community overview training, some of what we need to communicate is what should people expect as a participant in the process? How do you be a good team member? So that's included in the overview training. The next one talks about facilitation training. As I said earlier, it's about looking to build the basis or the bases for consistent implementation. The training will be built around didactic and practice experiences that cover all 4 phases of the wraparound process. You know, one of the things I think many people have experienced is when you go to an intensive training about a service process, a planning process that reaches from day 1 to as many as 18 months later, being trained in all 3 phases at the beginning gives you a great groundwork, but by the time you get to transition, sometimes folks forget we're doing some, we're not holding transition out there at the end, but we're trying to do some scheduling of training so that people get a chance to think about the engagement and planning phases and then get to think about implementation and transition separately so that folks can really reflect and build some skill sets around that. That training is after really continuing to help people translate these wraparound values into actions to really get to these targeted, diverse, individualized plans in partnership with young adults, their families, and the people around them so that we can get to outcomes that make some sense. That is projected at this point to be, by me as one of the key trainers at any rate, to be a 3-day training spread out over less than 30 days. And there'll be more details that come about that as the scheduling gets worked out, as Patrick talked about. The next slide talks about coaching. Really wanting to equip a small cadre, so to speak, of folks to support effective wraparound work in communities. At this point, what I would tell you is that the areas of content is that a coach needs to be experted, well-grounded in the practice model and the details of how it happens. They need to have a strong capacity to do troubleshooting as a team, meaning child and family team, as we've called them, in wraparound at the organizational level in terms of where wraparound is housed and operated out of, and also in the community system nest that it exists in. The goal is clearly for coaching is to support effective growth and learning for practicing staff. That doesn't, in my mind, just mean facilitators. facilitators need support in terms of supervision and guidance, and community systems need to be thoughtful and strategic about how you locate this capacity and how you manage it. And we hope to equip coaches to be able to do that well. And there may be a million questions, not all of which are answered, that need to come from this. If not, then maybe I've done a good job of sharing the picture of what happened. At this point, facilitation training is going to occur across multiple counties. The map that we looked at earlier, the bold counties, and I'm a little fearful of trying to name all 6 or 7 of them and get it right, but I think it's Stark, Summit, Franklin, Lucas, Butler, and I'm leaving somebody out, Guernsey maybe. But there were 6 or 7 counties that would kind of be the hub, as was mentioned earlier, to try to minimize travel time for folks, so that we could do that not only in terms of logistics, but also see people come together across counties in a region to be able to learn about each other's work and understand their practice better. Might be the beginning of some of the learning community conversation as well. The broad overview training that I talked about, I think may well need to be made available in specific communities and targeted because of some of what I suspect Cliff will find in the readiness questions, which is who do we need to give which information to? I think overview really exists at the system level and at the team member level, and we'll be thinking about and developing more details about that. Clearly, at this point, the training for coaches will be centralized because we're looking to have that be a core, ongoing, supportive function, and those folks will need to be together to be on the same page. We will see them gain experience as they move into coaching outside their own communities over time, presumably in some support with people like myself who've done that for a while, as well as being able to translate the experiences they've had in their home communities outside of that. So that, I think, is an overview of what you would see as the training. There's a piece, I think my screen just went to sleep. Give me half a second to get it back. There we are. There's a piece about quality assurance and fidelity that I want to talk about that, because in the end, all the training and the technical assistance is about trying to help us assure that the quality of what we do is strong. At this point, what we know is that, and these are tools, some, maybe all, I don't know. I don't know how many people go looking for this if you don't use it every day, but there are two key tools, the Wraparound Fidelity Index and the Team Observation Measure. The Wraparound Fidelity Index is a tool that develops input from a variety of sources around and creates a rating around fidelity across key principles and wraparound. And that happens with stakeholders ranging from families to providers to system management and many others that I didn't mention. The TOM, or the Team Observation Measure, is based in the observation of actual team meetings. It's really asking the question, did the team meeting process that was observed reflect the key principles in the wraparound process? Those two tools are the focus of Engage's quality assurance fidelity work. It is important for counties to know that, as I understand it, at this point, counties will be responsible for gathering their own data about this. There will be training about how this happens, and there will be access to technical assistance and kind of question answering, problem solving around how to develop the capacity to gather the data, but the data is going to be gathered. It will enter this RapTrack website. It will be accessible to individual counties through the Center for Innovative Practice. I think they're the folks that will kind of hold all the data together, so to speak, as that happens. But it's important to talk about that in connection to training, because part of the training, one of the training goals is certainly to impact the quality and fidelity of what happens in terms of the wraparound process here in the state of Ohio as this emerges. I think that's got my part.
Thank you, Neil. I have a question here for you. How many coaches and facilitators should each county identify?
The facilitator, no, I'm going to answer those two separately. The facilitator question, in my mind, has to do with the decisions each county and community make about how much capacity you need and want to have. For the purpose of Engage, this is targeted to youth, young adults in transition. And so the question is, how many of those folks who meet the criteria that were outlined by Angela earlier do you see, and how many of them do you see a need to develop an individualized response for? I mean, one of the other lessons I've learned over time about wraparound is if you know what to do for a youth or a family, or for that matter an older adult, do it. If you don't know what to do in terms of help, then do wraparound. And so I'd ask you to think about, in terms of answering the facilitator question, how many people in this population in your community do you see yourself needing to create an answer for because what's in place hasn't gotten them, helped you get them and support them to have the opportunity for the kind of quality life you have. And I think in each county, that's different. I know counties in Ohio who currently, to my knowledge, have one facilitator or even less than one in terms of a partial FTE. And there are counties in Ohio with a significant number. Some of that's based on county size, urban, rural, those kinds of things. So how many, I think, probably should be undertaken in an ongoing conversation about what you want your capacity to be and what you see the need as. Coaching, at this point, one of the things that's happened in wraparound is it's emerged as a field or a sub-part of the field of human service. And one of the challenges is because it sits in this cross-system environment is that there isn't often a clear career ladder. And so as folks have begun to talk about coaching as an important support to quality implementation, coaching begins to look like a good place to go. In other words, I've been a facilitator or I've been a manager for a wraparound project and now I want to go ahead and coach. And I've had the experience of participating with states who wanted to train as many as 20 and 30 and 40 coaches and have ended up using 6 on the statewide level. My experience leads me to say that not every county has to have a coach, that the expectation at this point, as I understand it, and I'm sure Angela and Patrick and others can weigh in if I've misunderstood, but my sense is at this point we are looking for a cadre of coaches that might be regional, minimum of 1 per region for the state, so that starts to look like 6 to 8. In a county with a bigger implementation, you might want to consider how to develop or access more coaching than that model could afford. Long answer to simple questions, but the bottom line is I think facilitation should be developed and answered in your community based on what you see in your system around this population, and that coaching typically at this point I think would be offered as a technical assistance capacity on a regional basis.
Thank you, Neil. And I just want to add that, this is you are serving in our first cohort of communities. So, that old saying, we're building the bike while we're riding it. We are really looking to you all, and you all were selected because of your experience with wraparound over the years for feedback, ideas, lessons learned, suggestions on approaching training, technical assistance, a regional notion for coaches differently, et cetera. So, today's presentation is just to give you an overview of how this will proceed forward, but I definitely wanted to let you all know that, we haven't made final decisions on any of this yet. And I have one more question, and I will direct this to Patrick and Rick. When you talk about technical assistance and training for the first cohort regarding cultural competence and trauma, is that just for wraparound staff or our whole community?
Yeah, that's a really great question. I think it falls into the bucket that Angela just mentioned, which was I think there are still decisions to be made about how best to do that. We certainly know that in the implementation of wraparound and in the training that Neil will be doing and others, that certainly the issues of cultural competency, and I think probably to some degree trauma, perhaps a little bit less so, are certainly incorporated. We know that the state, MHAS, has a trauma-informed initiative that's unfolding now. In fact, getting ready for kind of a launch date later in the summer. And we know that there are resources for cultural competency training. So I think it's a question we're still looking at as to whether this really should be focused specifically on the kind of engage community, if you will, or making it broader because it certainly is relevant to the larger community. So I'm going to have to give you kind of an in-between answer. It's certainly going to be part of the available training, but whether it takes place directly under the umbrella of GAGE or perhaps in a greater, broader venue, I think we're not absolutely sure yet. But you will get...
Thank you, Patrick.
Sure, sure.
We have addressed all the questions thus far, so we are going to move into the evaluation portion for Engage, and I will turn it over to Scott Wingenfeld, who will be leading this discussion.
All right, so now on to the fun of evaluation and data collection. Like Angela mentioned, my name is Scott Wingenfeld, and I work here at the Department of Mental Health and Addiction Services. Now, if any of you have ever worked on any federally funded programs before, you're well aware that there are always going to be data requirements that come with it. So you can get used to receiving many emails and calls from me in the next year or so, badgering you for data over and over again. But first, I just wanted to give a quick overview of what the basics of evaluation is and briefly outline our plan for how we're going to move forward. First off, evaluation is not really intended to punish or discipline you. It's not intended to point out your flaws or in any way. It's mostly just intended to describe the experiences and implementation practices across all of our sites that we're going to have. We really want to identify the best practices and drill down to what works and what doesn't work to come up with effective strategies moving forward. We really want to understand the barriers and facilitators to successful implementation. We're going to document our lessons learned, and then we're going to improve our implementation practices. You guys are the first cohort, so you guys are kind of going to blaze the trail for the rest of the state in this regard. So hopefully we'll get some really good information from you guys that we can use when we roll out to the rest of the counties. So there's really two different levels to our evaluation. First is our client and family level, and this is where we really want to kind of drill down and figure out who it is we're serving. So this is collecting information such as the client population, demographic information. Then we also want to track outcomes over time. So we have a couple different instruments we're going to use for this. We're going to use the GIPRA National Outcome Measures, which I'm sure some of you might be familiar with if you've worked on any federal grants. We're also going to use the Ohio scales, and we're going to try and implement the CANs as this is kind of gaining ground throughout the state, so we thought this might be a good measure to use, and some of you guys might be familiar with both of those as well. We also want to assess the youth and caregiver appraisals of service. So we have the perception of care scale. We ask for that, where we can really figure out whether or not kids and their families like these services, how satisfied they are, that kind of thing. So going down to our methods, each site is going to conduct interviews with either the caregivers or their youth who are receiving services, and then I will enter those data through SAMHSA's track system. So we plan on doing these structured interviews at baseline or intake, 6 months, 12 months, and then also a discharge interview. And there will be incentives for the youth that fill these out, and also possibly incentives for the volunteer data collectors. So keep that in mind going forward. The second level of our evaluation is kind of the system level evaluation. And this focuses more on the sustainability and also that kind of growing over time aspect of the program. We really want to look at the interagency linkages at the service levels. So, for instance, we'll be using the levels of collaboration survey for this. Then we want to describe the geographic spread of the population served. SAMHSA really just wants a snapshot of the process of how this all rolls out. So when they go to grant funds for their newer grantees, they will have kind of a nice visual of what works, what doesn't work, and then we can kind of be used as a model going forward. So like I mentioned, we're going to use some network analysis like the levels of collaboration scale to determine this information. We also have access to some GIS analysis. And then basically I will be talking with a lot of the individual sites, maybe doing some focus groups, individual interviews, basically just to figure out what it is and what you guys are doing specifically. Going into our evaluation plan specifics, each of these goals on the left-hand side describes kind of what I just went over, the 2 levels of the evaluation. The GIPRA IPP indicators, those are the SAMHSA snapshot that I mentioned. They really want to get information about policy development, workforce development, how you finance, any organizational changes that might occur during the grant, again, all your partnerships and collaborations, accountability and awareness. And I'll be collecting this data using SurveyMonkey, like I said, and probably some focus groups and interviews as well. And also I'm required to submit that to the track system on a quarterly basis. CQI process data, which Chris will refer to here in a second, is going to look a lot at the infrastructure, your readiness to change, partnerships and collaboration, accountability, and also kind of drill down into some of the really specific aspects of wraparound. Chris is going to use some plan of care documents to collect this information, which you should go over here in a second. And again, these are going to be on a quarterly and semi-annually basis as well, which we'll report out to the management team and also create as many reports and things as possible. The GIPRA noms are kind of the bread and butter of our evaluation. It's what we're federally required to submit. That's where our money comes from. So that's where my emails will come in. So that collects all the demographic information, functioning, housing stability, employment and education, criminal justice status, the perception of care, social connectedness, reassessment status, discharge status, the services that each child's received, and their global assessment of functioning score. And again, those will be done using structured interviews via a data system that we haven't quite determined yet. And all that will be submitted to the federal government via track system. And you will be submitting those interviews as they come up. Those need to be submitted as soon as possible. We do have some additional client-level outcomes, like I mentioned before. We're going to be using the Ohio scales, the CANS, and ANSA-T, and also those should be implemented into our data system. So once that's up and in effect, you guys should be able to sit down and collect all this information and submit it to us through a portal, all in one sit down. So that should be it should be as user-friendly as possible, and try and really reduce the burden on you guys. We know you're all busy as it is. And those will be done at each interview at intake, 6 months, and discharge as well. Really, I just wanted to stress that we're really here as a resource for you all also, and that any data requests that you might have, if you are interested in any specific outcomes that your site might be interested in, we can always run reports for you and get those back to you and kind of work with you along. This is kind of a learning process for all of us, so anything you guys need from our evaluation teams, we're more than happy to provide. And now Chris is going to go over his CQI portion.
Hi, everyone. This is Chris. So the slide you have in front of you is a kind of a feedback loop that represents a continuous quality improvement process. I used the example here to talk about a few key areas. Scott and I will be forming a CQI work group where folks from different sites that are interested in kind of participating on a team to help us think about the data, talk about the data, create reports, how to structure the data. We'll come together and work quarterly to produce meaningful feedback and reports. So systems of care, they have a lot of interrelated parts, and we want to make informed decisions and course corrections using data where we can. So step one is looking for data sources that we have that are kind of reliable and consistent. You might take data from the GIPRA, from the CANS, Ohio scales, from process-oriented measures about like contacts with clients. And you would look at that data and structure it in a way to create a measure, a metric. So for example, you might have % of clients being seen within the first 30 days, or a measure might be the % of clients having 3 contacts a month. I mean, you could have process-oriented measures like that. You would get together as a team and review the data and how things are going and look for benchmarks. Now, some benchmarks will be kind of criterion-based, like there's an understood threshold, like clients should have 3 contacts per month, and you set that benchmark. Other types of benchmarks are normative, so you might look at where are we as an average number of contacts, set that as your benchmark to make improvements or changes over time. So you'll work together with a team to kind of set those benchmarks. And it's a process. You'll then collect data and look again and see how changes were made on those benchmarks in step 2. Step 3, that's having kind of an honest, open dialogue about really how can we affect change. You'll see different movements in your measures. Sometimes they'll be what are systemic, like everybody, all 28 counties seem to be kind of low on this measure or showing this measure. What is it that's systemic about this process that's occurring? You might think differently about that than something that's more variable, where some counties are higher, some counties are lower, some seem to show more change than others. Then you talk about that in your group and pair up and find out kind of what are the strengths of someone performing well, what could we learn, how are they different in that feedback loop. And step 4 is creating an action plan, and that's based on what we're seeing. What would you do differently? What do you think could make some kind of change? And that might be, a focused supervision meeting or something, attending to a detail in that data to see if you understand it better, you can make changes. In step 5, the last step, that's kind of things settle down a little bit and you start to generate consistent measures and have quarterly reports to review. The first 3 or 4 steps can take 12 months just to understand what you're looking at. Some measures you might have validation questions, like are we really measuring what we think we're measuring? So by the time you get to step 5 and some time has passed, you feel more confident, you know more about the data, and then you reassess. Maybe you have new benchmarks. Maybe you realize, this is as good as this is going to get. We're going to focus on some new measures and prioritize elsewhere. So that covers, I guess, the CQI process and approach that we'll be taking.
Thank you, Chris. And I have a couple of questions. One, will counties have to pay for access to the Wi-Fi or other tools for which there is a fee?
No, those licenses have been taken care of. My understanding is by kind of the administrative payments and work that we're all associated with here at our level.
Correct. And then the next question, can you get a gap if MH or DA have closed before discharge?
So I'm not entirely sure if they're asking whether or not a mental health or a drug addiction counselor has to provide that score. A couple years ago, our office created a GAF calculator on our website, which I planned on using for this. And it's really kind of an intuitive, user-friendly type thing that a volunteer counselor or anyone sitting down with the kid during the interview process could calculate pretty easily. So I don't think that will be an issue. I hope I answered that one.
Thank you, Scott. Now we're going to move into discussing the transition to independence process model, and Rick Shepler will be going over that. So Rick?
Thank you. Our transition to independence process in Ohio, actually, we're going to be utilizing Patty Fetzer from Stark County, who is our certified and national TIP trainer. Unfortunately, she couldn't be with us this afternoon, so you get me. Next slide. So the transition to independence process is actually a process that Rusty Clark out of the University of South Florida and his colleagues developed over the last probably 20 years or so.
And what we're going to be doing here with this project is we're going to see how TIP can be used to inform the wraparound process that we're rolling out. So TIP utilizes components of the transition to independence process to inform wraparound process. Some of the main things that we're going to pull from this is that, and one of the differences is that especially for kids 18 or young folks, ages 18 to 21, youth and young adults the system will be youth and young adult driven and family supported versus family driven and youth guided. There will be an empowerment and support focus in the wraparound work that we do, especially again for the youth and young adults that are 18 to 21. Supports youth and young adults in their own futures planning process and movement toward greater self-sufficiency. Developmentally and culturally appropriate services and supports for youth and young adults in transition. And one of the main differences is that we may utilize different life domains specific to young adulthood. Next slide. And this is some of the transition domains that you can see from the TIP model that Rusty Clark put together. Some common ones that may be used in a wraparound process would be employment, education, housing, community life and social functioning, what supports does the young adult need to be successful. We talk about health care, benefits, physical care and behavioral health care, legal and possibly even transportation. So as you can see, working with a young adult in transition, the life domains kind of expand a little bit into the adult world, if you will. Next slide. So some other considerations for a TIP-informed process for wraparound. We may need to adapt our engagement strategies with young adults. The youth and young adults also will be defining who their family is and their team members, which may change over time. And we also might need to work with family members who may need support and new skills during the emerging adulthood developmental phase, and maybe letting go a little bit. With young adults, we would be working with the young adult to co-develop a safety net of supports for them and also working with them as they drive their own safety and prevention plans. So these are some of the things that we are going to use from the TIP model to help inform how we do wraparound a slightly bit different for young adults age 18 to 21. Thank you.
Thank you, Rick. And Scott did such a great job of selling the gap calculator that we have two questions. One, what website is the gap calculator on? And two, could you give us info on how to access the gap calculator? So we could send out a link to all of the participants on this webinar today with the to the website that has the gap calculator. All right, we are moving into the final section, which is on engaged resources and support. There are quite a few people involved in Engage, so we wanted to make sure you all had a good understanding of who we are, what our role is with Engage, and provide you with our contact information in case you want to reach out to any of us as we move forward with implementation. The first group that we want to highlight is the Center for Innovative Practice. They, through a competitive bid, are our lead contractor for wraparound training and technical assistance. So I will turn it over to Patrick Canary to discuss their role in more detail.
Thanks, Angela. So, this slide's pretty explanatory. We have our primary area, obviously, is going to be in the training of the facilitators and the coaching and making sure that we are meeting the needs of our constituents, which would be you all. We are going to be doing the training around the development of the fidelity outcomes that Neil referenced at the end of his presentation. It's an online system, and I believe there's probably 3 or 4 folks on this call in the communities who are already using the WIFI and the TOMS, and probably could attest to the fact that kind of once you get into it and used to it, it's a pretty easy system to use. And again, it's going to be a way for us to give feedback to you all and to your wraparound teams in terms of performance and where things are rocking and rolling and where things may need to have a little more attention. The TA upon request would be, any number of things that an individual county or site is confronting, and we will look in our toolkit to see whether that's something we can respond to. We certainly hope we'll be able to, and then tailor that TA to individual sites. We're going to be doing, obviously, further work on the tip and wraparound piece. Rick just gave the briefest of overviews, so Patty is working with us on that, and we'll be very anxious to see how that works in implementation, because it is a pretty significant adaptation of the wraparound model, and one that's pretty exciting to look at for this population of youth and young adults. We'll create, and have not yet created, but we will be creating a wraparound resource page on our CIP website, and you'll all get notices of that. And then we will probably record and post periodically webinar trainings, of general interest, and just make those available to folks. Perhaps topics that don't necessarily require as much of an interactive style, but just more informational. And the next slide. So here's who we are and our email addresses, and feel free to reach out to me and other team members as this implementation rolls out. Thanks.
And then the next slide contains our youth and family engagement contacts. As I stated earlier, NAMI Ohio, through a competitive bid, is leading up our youth and family engagement activities, and they have contracted with these individuals to take on the specific roles. Angela Lariviere, many of you may know her. She serves as our youth and young adult supporter to our two youth and young adult engagement coordinators, who are Katie Dillon and Raphael Weston. And then we have a family engagement coordinator, and that is Esther Hawkins. So we definitely wanted to let you know who they are, provide you with their contact information so you could reach out to them as you move forward. And then finally, as I also stated earlier, we have an engaged management team, which all of those individuals also serve on the management team, but I wanted to highlight the other ones that we haven't brought into this webinar yet. Joyce Callan and Chad Hibbs, they are our Family and Children First regional coordinators, and thus they're the regional coordinators for Engage as well. Craig Knudsen serves as our lead evaluator. Scott, who's been on this webinar, he is our evaluator. John Hurley serves as our trauma coordinator. Rod Manning is from DYS, and he serves as our DYS representative. Sue Williams with JFF serves as their representative. Laura Rooney serves as the Ohio Department of Health representative. And then most of you, or all of you, should know Tammy Payton. She serves as our assistant for Engage and for Family and Children First and for our Bureau. And she's also the one responsible for setting up this webinar today. So we all need to thank Tammy today for that. So this concludes the webinar. We want to now allow the time that we have left to really answer your questions, or at least field your questions. We may not have answers to all the questions. What we plan to do is, if we're not able to answer all of the questions today, that we will definitely put together a Q&A that we can send out to all of you post the webinar. I do have a couple of questions popping up here, but you can now also ask questions by raising your hand, if you recall from the beginning, in the little chat box as well. In the question box, there's one: can we get contact information for the other engaged counties in first cohort? Absolutely. We will put together a contact sheet for all of the engaged counties and who the lead contact person is for those counties, and make sure we get that out to all of you. That's a great suggestion. There's another question. You mentioned developing a contract or MOU with counties. When will that occur? We're actually calling it a cooperative agreement. That's what SAMHSA has with the department, so it just seemed fitting that we would make the same agreement with the counties. And we are hoping to get that out to you no later than the end of May. It has to go through legal here, so I don't want to give a specific date, but I'm hoping by the end of May that that will be out. And as I stated earlier, it will we need to know from you who your lead contact person or persons will be, who the fiscal agent is, so we know for the Engage funding who we would allocate the funding to as the fiscal agent, and then really spell out the roles and expectations between the Engage management team and in your community. So hopefully by the end of May. Another question: do you know yet when we can use the do you know yet what we can use the $2,000 for? Essentially, the $2,000 is per youth. So when you enroll a targeted youth and young adult that fits our targeted population definition into wraparound, Engage wraparound, we will provide you upfront money for that, and then halfway through the wraparound process, we'll allocate you some additional funding, and then at the end of that case, we'll send you the final payment of that $2,000. On our end, it's our way of providing support to you and recognizing that you provided wraparound to this youth. Locally, from the SAMHSA perspective, we allocated funding to you for providing wraparound to the youth. Locally, you could choose to do whatever you want with that $2,000. So that's up to you. I'll pull this one up. Oh, and then this, I guess it's a continuation, I think. Will it outline the payment process to counties for facilitation? Yes, the cooperative agreement will outline the payment process to counties for wraparound facilitation, and it's essentially what I just stated on what the $2,000 could be used for. Next question: should we direct questions or comments to our regional coordinator or someone else? Really, we've shared with you this contact list today so that you can direct your questions to whomever would be most appropriate. So if you have training and technical assistance questions, you could direct the questions to the Center for Innovative Practice. If you have more just general Engage questions, definitely direct them to your regional coordinators. That would probably make the most sense. If you have questions about youth and family engagement, again, you have that contact information. So feel free to use the contact information however it seems best. Okay, I'm trying to go through this here. Okay. Can we get these slides as a PDF for easier reference? Yes, we plan to send out after this webinar the slides in PDF along with a link to this webinar audio that we've recorded if we successfully recorded it. Can't promise you that yet, but we're hoping that that will be available. We will also send you the link to the gap calculator that we promised and the contact information for all of the communities in the first cohort. If a county joins Engage, will they need to update their service coordination mechanism to reflect wraparound as a service? That's an excellent question, and we definitely will follow up with you more on that one, but I would state that if your service coordination mechanism reflects the wraparound process, then you most likely will not, but I know that every county service coordination mechanism varies. So that's probably on an individual county basis. So we'll definitely have to follow up with you more or less, but we can, if that's something of a need across this first cohort, myself and the regional coordinators can assist counties with that. Next question, what if the youth drops out in the process and the money goes unused? What happens? We're setting this up very similar to the home choice model. So for counties that are familiar with that, you essentially get a payment up front, halfway through the process, and then at the end of the process. So wherever you are in that process is, again, we're kind of working these details out still, but wherever you are in that process, you would get that amount of money. So that's our thinking around that right now. And in terms of the evaluation data portion, even if they do drop out, we do have their initial data, which goes to our evaluation as well. I mean, it's definitely critical to capture those that do drop out. Is there a limit to the number of youth a county can enroll? No, there's not a limit of the number of youth a county can enroll. There's a limit to the total number of youth can be enrolled and engaged due to our limited budget right now. So that's the issue. So when we get up to that final number of enrollments each year, we will have to then stop payment on or stop enrollment of youth in wraparound, or we would not be able to reimburse you for anyone beyond the number that we can support in our current budget. And by year, we have set aside 220, and then this is where it gets a little challenging because it's a 4-year grant, but this first year we've really taken the time to set up all of this and to be able to launch in July. So we're technically a year behind. So our numbers aren't actually 220 a year. Next year we'll probably be shooting closer to about 400 or so. So we'll work with you all on that and let you know what our target number is and work with you on what that means to your county and then across the state and enrolling youth and engage wraparound. So, Rochella, I've unmuted your line. I saw that you had a question. Okay. Rochella? That didn't work. All right. Well, Rochella, we can't hear you, so if you could type your question in the question box, that will probably work the best. And no questions. Okay. So the only last question that's come up is from Rob Manning. So Rob, we can work on this in engaged management meeting, but he said we need to give a definition for homelessness. So we can talk that through at our next management meeting and let you know if we need a definition for homelessness and if so, what that really entails. In another meeting yesterday, there was discussion about really needing to define what at-risk for child welfare and juvenile justice means as well. So I think we have a couple of areas we need to work through to get some more clarification. That's all the questions I have here. I'm muting Patrick, Rick, Chris, Neil, Cliff, if any of you have anything else you want to say.
I'm good.
We're good.
I'm muted. So's Neil.
Oh, there is one more. The question is, will we be using Wi-Fi or Wi-Fi Easy? And I'll unmute Patrick and Rick and Chris.
So, really good question. I think I'm going to punt on that and talk to Dr. Timmons-Mitchell, who will be doing our fidelity training. But I would say that we'll use whatever, first of all, is the most recent current and any recommendations we might get from the National Wraparound folks. But good question. Good question.
And there's a follow-up question, Patrick, which may just need to be passed along too. But that is, and will counties be doing it or someone else administering it?
The expectation right now is that somebody, whether it's the facilitator or somebody from the agency where the facilitator is employed, if that's the case, or someone else on the team, would actually do the input of the data. That would not be done from outside of your community. So we'll rely on working that through with whoever at the local level is going to be responsible for that.
Okay, and just to follow up with that, which may just mean we need to have more conversation with our communities, but Heather Wells from Butler stated if counties do it, we can't do the WIFI, but may be able to do the EV.
Okay.
FYI.
Great, thanks. I'm clearly not the expert on the WIFI, so we'll make sure we get the right information back to you. All right,
I believe that we've answered all the questions that have come through, and there are no hands showing. So we'll be in touch with more information. Expect the community of the cooperative agreement to be out to you, or at least to your lead contact person that we have on file, and that's the person that completed the readiness assessment by the end of this month. And then, as we stated earlier in the webinar, Cliff Davis will be in touch with you to set up the on-site assessment. So that will be occurring if you haven't been contacted by them already. And expect some more communication from us. And in the meantime, if you have any questions, you have our contact information. Please feel free to send your questions our way. And you know, based on the questions that come in, we may start creating a Q&A just so it's helpful for everyone in the first cohort.
Great. Thanks.
Thanks, everyone. Enjoy the day.
Thank you.
Thank you.